hygiene, 20 seconds. Hello, my name is Susan and I'm going to be your nurse for today. So today I'm going to be doing some tracheostomy care for you, but right before we begin, I would like to establish a form of communication with you, as I do realize that you are not able to respond to me verbally. So if you can go ahead and give me a thumbs up for yes, thumbs down for no, and please raise your hand if you would like me to stop. Is that okay with you? Thumbs up, yes? All right. So I'm going to go ahead and take a look at your patient ID wristband to identify you. So your name is Sebastian Jones, is that correct? Thumbs up, yes. And is your date of birth January 12, 1963? Thumbs up, yes. All right. Okay, Mr. Jones, and do you happen to have any allergies? Thumbs down, no allergies. Perfect. All right, so I'm going to go ahead and quickly take a set of vitals for you. So your vital signs are within defined limits. However, your respiratory rate is a bit high. It is at 24, and your oxygen saturation is a bit low. It is at 92%. Are you having any pain right now, Mr. Jones? Thumbs down, no pain. All right, so I'm going to go ahead and take a quick listen to your lungs. I'm going to be listening to 6 spots in your front chest. Please take a deep breath in and out as I move my stethoscope around. Okay, warming it up. Deep breath in, out, in, out, in, out, in, out, in, out, in, and out. All right, so I do hear some crackles in your lungs, which means that there are secretions that need to be suctioned out. So with that being said, as I mentioned before, I'm going to be doing some tracheostomy care for you. I'm going to be suctioning out the secretions out of your lungs to help you breathe a little better. I'm also going to be changing your inner cannula, replacing with a new one. I'm also going to be cleaning your faceplate, removing of any secretions, and just making sure everything looks intact and looks good. And lastly, I'm going to be changing your tracheostomy stabilizer, which is around your neck. Have you had this procedure done before? Thumbs up, yeah? All right. So right before I begin, Mr. Jones, do you have any last questions or concerns for me about the procedure? Thumbs down, no? All right. So now I'm going to go ahead and make sure that I have all my supplies ready and available. So for the bedside emergency supplies, here I have 2 trachs, one trach that is your size 8, another trach that is a size smaller, and it's a size 6, and that's a size 6. I have an extra inner cannula. I have an ampu bag that is attached to 100% oxygen at 15 liters. I'm going to go ahead and give it a squeeze, make sure that it works. And it works, and I know that it works is because I see that the bottle is at 15 liters. I see that you have a trach mask collar that is attached to 6 liters of oxygen per the provider's orders. And lastly, I have a working suction catheter that is connected to a suction canister. And as for the supplies that I'm going to be bringing in, I have some sterile saline. I have an inner cannula, stabilizer, tracheostomy care kit, and a suction catheter kit with a sterile disposable container inside. All right, so now that I made sure that all those supplies are ready to go, I'm going to go ahead and do some hand hygiene, 20 seconds. I'm going to don some new gloves, new clean gloves. Okay, and then I'm going to go ahead and wipe down my surface for 30 seconds. Alright, so I made sure to wipe down the surface for 30 seconds, making sure I got the edges and the whole surface. So now I'm going to go ahead and let it dry for 2 minutes, just to kill off all the bacteria. So now I'm going to go ahead and do some hand hygiene. Alright, Mr. Jones, so I see that your bed is already up at a working height level for me. I'm going to go ahead and assist you into a semi-Fowler's position. Are you comfortable in this position, Mr. Jones? Thumbs up, yes? All right, and now I'm gonna go ahead and close the curtains just to ensure privacy. Okay, so now that it's been 2 minutes, I'm gonna go ahead and do some hand hygiene, and I'm going to place all the supplies onto the surface. So I'm gonna don some new gloves. Okay, so this. Okay, now I'm gonna go ahead and open up my Trach kit. Okay, now I'm gonna remove the pair of sterile gloves. I'm also gonna be taking out the drape and putting it onto the patient. Okay, making sure I'm only touching in the 1-inch border. Okay, now I'm gonna go ahead and drop in the inner cannula. Okay, now I'm gonna go ahead and open up my suction catheter kit. And I'm going to take out the sterile disposable container. And I'm gonna be pouring in the sterile saline halfway in the box, as well as halfway in the tray as well. Okay, now I'm gonna go ahead and take out the suction catheter and replace it because I'm not sure when it was last replaced, and I just want to make sure that it's clean. So I'm gonna go ahead and replace it. Okay, now I'm gonna go ahead and test out the suction. Okay. Right, so now I'm gonna go ahead and take out about 3 to 4 inches. I'm gonna occlude the hole, test it into the sterile saline. All right, so I see that the pressure is currently at 180 millimeters mercury, which is too high. So I'm gonna go ahead and titrate it down because we want the suction to be set at a range of about 100 to 120 millimeters mercury. Okay, so I'm gonna go ahead and include the hole and test it again. Okay, and now the suction is set. I see that the suction is set at 120 millimeters mercury, which is where we want it to be. And it is working properly. All right, so now I'm gonna go ahead and prepare to actually suction out the secretions. So I'm gonna go ahead and remove my gloves. Hand hygiene, 20 seconds. I'm gonna don some new gloves. Okay, and Mr. Jones, I see that your oxygen saturations are still low. They're at 92%, so I'm going to be hyperoxygenating you to raise it up a bit. So I'm going to go ahead and stabilize your faceplate and remove your oxygen source. I'm going to go ahead and give you a few breaths. Stabilizing. 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 6. Okay. All right. So I see that your oxygen saturation went up to 98%, which is good. So now I'm going to go ahead and start suctioning. Okay. So I'm going to make sure. Okay. And I'm going to expose the catheter about 3 to 4 inches. I'm going to dampen it in the sterile saline. Okay. And I'm going to be advancing it into the inner cannula until I feel some resistance or hear the patient cough. After that, I will be occluding the hole and taking it out as I suction. All right, so now I'm going to go ahead. Okay, occlude. All right. How was that, Mr. Jones? Are you feeling a bit better? Thumbs up. Went well. Thumbs up, you're feeling a bit better. All right. So I see that your oxygen saturations is still at 98%, which means that I do not need to hyperoxygenate you anymore. So I'm going to go ahead and stabilize your faceplate and put back your replace your oxygen source. All right, so now I'm gonna go ahead and take a listen to your lungs. I'm gonna be going right under your drape. Please take a deep breath in and out for me as I move my stethoscope. Okay. Deep breath in and out, in and out. All right, so I do hear less crackles. That means that there's less secretions. Your lungs sound a bit more clear. So that means that there is no need to do any more suctioning. But in the case that another suction pass is needed, I would have to wait 30 seconds before doing so. Okay? Now I'm gonna go ahead and remove my gloves, hand hygiene, 20 seconds. I'm gonna go ahead and put on some new gloves. Okay, all right, Mr. Jones, so I'm gonna be replacing your inner cannula now. Okay, so now I'm gonna go ahead and stabilize, remove your oxygen source. I'm gonna go ahead and stabilize again and remove your old inner cannula. I'm gonna dispose of it. I'm gonna reach in, grab the new one, making sure I am only touching the tip of it. And I'm gonna be inserting like that and then clipping it on. All right, now I'm gonna go ahead and change your trach dressing. So I'm gonna go ahead and remove your old dressing. Okay, and I'm gonna do a quick skin assessment. There's no signs of infection, there's no redness, no skin breakdown. However, I do see some secretions around the faceplate, but don't worry, I will be cleaning that right off for you. So I'm gonna go ahead and soak 3 pieces of gauze into the sterile saline, as well as dip my 2 Q-tips in it as well. Okay. And I'm gonna go ahead and stabilize, and I'm gonna be cleaning right under. 1 swipe. Dispose. Okay, another swipe on top under the faceplate. Dispose. I'm gonna go ahead and take out the first wet gauze. I'm gonna be stabilizing, cleaning right under. Dispose. Same on top. Dispose. I'm gonna take the last piece of wet gauze and I'm gonna be cleaning around on top of the faceplate. Dispose. And I'm gonna take the last piece of dry gauze and I'm gonna be patting the area dry, making sure everything is dry. Okay. Now I'm gonna go ahead and place the new trach dressing. All right, so now that new dressing is on, I'm gonna go ahead and replace your oxygen source. All right, Mr. Jones, how was that? Thumbs up, that went well. Did you experience any pain throughout the procedure? Thumbs down, no pain. Are you having any difficulty breathing? Thumbs down, no. Any shortness of breath? Thumbs down, no. All right, so that sounds good. All right, Mr. Jones, so I'm almost done here. I'm gonna go ahead and take off my gloves, hand hygiene. All right, Mr. Jones, so I'll be back. I'm gonna go ahead and go out and get one of my fellow nurse colleagues, and we're gonna come back and I'm gonna be changing your tracheostomy stabilizer. All right, I'll see you in a bit, Mr. Jones. Hello, Mr. Jones, I'm back. I have Nurse Kayao here with me. She's gonna be helping me change your old tracheostomy stabilizer with a new one. Right before we do, we just did hand hygiene for 20 seconds and we both have goggles and masks on. I'm gonna go ahead and put on some new clean gloves. Okay, I'm gonna go ahead and stabilize your faceplate and remove your oxygen source. And Nurse Kayao is gonna hold on to the faceplate for me as I remove your old stabilizer. Okay, and now I'm gonna do a quick skin assessment. There's no signs of infection, no redness, as well as no skin breakdown as well. So I'm gonna go ahead and place your new stabilizer. Okay, all right, Mr. Jones, so this is gonna go around your neck. Now I'm gonna go ahead and stabilize the faceplate as Nurse Kayao takes off and puts on the other side.
There's no redness or signs of infection or skin breakdown on this side as well.
Okay, and we'll be measuring with 2 fingers to make sure that the collar fits properly.
Yes.
2 fingers on this side.
2 fingers on this side.
Okay. All right. So now I'm gonna go ahead and stabilize the faceplate and put on your oxygen source. Okay. Now I'm gonna go ahead and dispose of all the supplies. Remove my gloves. Hand hygiene, 20 seconds. All right, Mr. Jones, how was that? Were you able to tolerate the procedure well? Thumbs up. Okay, great. Do you have any pain, Mr. Jones? No pain and discomfort? Thumbs down. Okay, perfect. All right, Mr. Jones, so I'm going to go ahead and take a set of vital signs for you. So your vitals are within defined limits. Your respiratory rate went down to 16, and your oxygen saturations went back up to 98%, which is great. Now, Mr. Jones, I'm going to go ahead and take a listen to your lungs. Please take a deep breath for me. Okay. Deep breath in, out, and deep breath in and out. All right, Mr. Jones. So your lung sounds appear to sound more clear. There's less crackles, meaning there's less fluid. All right, Mr. Jones, so my work here is done. So I'm gonna go ahead and go document what I did. I'm gonna make, but right before I do, I'm gonna make sure that your bed is in the lowest setting, that your side rails are up for safety. I'm also gonna make sure that your cowbell is within your reach. Feel free to press the button whenever you need anything. All right, Mr. Jones, right before I go, do you happen to have any last questions or concerns for me? Thumbs down? No? Okay, great. And is there anything that you need from me right now, or is there anything I can do for you? Thumbs down? Okay, great. All right, Mr. Jones, I'll see you later. Now I'm gonna go ahead and go document. I'm gonna do hand hygiene, 20 seconds. All right, so now I'm gonna go ahead and go document the time and date that I have done this procedure. It is October 13th, and the time is 17:30. I'm going to document that the patient tolerated the procedure well. The patient's breath sound more clear. There were less crackles, meaning there was less fluid. I'm also going to document that the vital signs were within defined limits, except for the patient's respiratory rate and oxygen saturations. The patient's respiratory rate started off to be at 24, but went down to 16 after the procedure, which is good. And the oxygen saturation started off at 92%, but after the procedure and suctioning, the oxygen saturation went back up to 98%, which is great. And I'm also going to document that the patient's sputum was clear and thick with a moderate amount of secretions. Lastly, I'm going to document the skin assessment. I assessed that there were no signs of infection, no redness, and overall no skin breakdown around the peristomal site.